1. How much do Floridians really spend on healthcare? WalletHub Insights. 2. Funding shortfalls in Florida's rural healthcare, what you need to know. 3. Florida Healthcare Policy Update, the impact of H.R. 1 and new legislation. 4. Impact of Trump's healthcare legislation on Collier County. 5. Impact of Trump's budget bill on health coverage in SWFL. 1. How much do Floridians really spend on healthcare? WalletHub Insights. The rising costs of healthcare are a pressing issue faced by many, and a recent analysis from WalletHub shines a light on the extent of spending by residents of Florida. Amid ongoing debates about the potential effects of President Donald Trump's ambitious, One Big Beautiful Bill Act, on the healthcare landscape, this report provides valuable insights into how much Floridians are actually spending on their medical care. So, how much exactly does healthcare cost Floridians? According to WalletHub's findings in its study, titled States Where People Spend the Most and Least on Healthcare, Florida has been positioned 18th among states with the highest healthcare expenditures. This ranking underscores the financial burden that many families face when it comes to medical expenses. To give you a clearer picture, let's break down some of the average healthcare costs incurred by Floridians. Average health insurance premiums $513 per month. Health insurance premiums as a percentage of median monthly household income $8.58%. To help ease some of this financial pressure, experts offer practical advice. They emphasize that having some level of health insurance is generally more beneficial than being uninsured. In emergencies, a lack of coverage could lead to catastrophic expenses. For those who are relatively healthy, it might be wise to consider a high-deductible health insurance plan, as it often comes with lower monthly premiums. For anyone wanting to dive deeper into this study and understand more about how health expenditures vary by state, you can find the full report right here, WalletHub Study, https://walletHub.com/edu/states-where-people-spend-the-most-least-on-health-insurance/1457713. As you ponder this information, think about your own healthcare costs. Do you agree with the trend? What has been your experience with healthcare spending in Florida? We'd love to hear your thoughts in the comments. Are you noticing more people opting for high-deductible plans? And should the focus shift to more affordable healthcare options for all? Let's start a conversation. 2. Funding shortfalls in Florida's rural healthcare, what you need to know. The reality is stark. Florida's rural healthcare system is facing significant funding shortages that leave critical gaps in services for these communities. Despite lawmakers proposing new funds this year, rural counties are set to receive only a small portion of the financial support they desperately need. This shortfall raises serious concerns about the future of healthcare access in these often overlooked areas. B. Lunardini, a seasoned reporter specializing in state government and politics, has been closely following this issue. You can reach her at blunardini@tampabay.com for further insights or to share your perspective. Join the conversation and make your voice heard. While anyone can browse a selection of recent comments, contributing your own thoughts requires a time subscription. If you're interested, simply log in above or subscribe here, https://subscribe.tampabay.com/digital-only?promo_code =$6759. Remember, the opinions shared in the discussion reflect those of our readers and are governed by the community guidelines, https://www.tampabay.com/community-guidelines. But here's the part most people miss: the funding gap isn't just a numbers game, it directly impacts the quality and availability of healthcare services in rural Florida. With fewer resources, clinics struggle to stay open, and residents often have to travel long distances for basic medical care. This situation sparks a crucial debate: should more aggressive measures be taken to ensure equitable healthcare funding across all regions, or is this disparity an unavoidable consequence of budget constraints? What do you think? Is the state doing enough to support rural healthcare, or are these communities being left behind? Share your thoughts and join the discussion below. 3. Florida Healthcare Policy Update, the impact of H.R. 1 and new legislation. The healthcare landscape in Florida is shifting, and it's time to delve into the latest developments that could profoundly impact the state's residents. Get ready for significant changes. Florida may soon feel the repercussions of H.R. 1, also known as the One Big Beautiful Bill Act. The anticipated changes to Medicaid and the Supplemental Nutrition Assistance Program, SNAP, are expected to have a far-reaching impact, especially in economically vulnerable areas of the state. This legislation introduces tougher eligibility criteria for Medicaid while shifting the financial responsibility for SNAP from the federal level to state governments starting in 2028. Such a transition could lead to notable gaps in Florida's support system, where currently, over 1 million households depend on SNAP payments and more than 4.7 million individuals are enrolled in Medicaid. In districts with a high number of Medicaid recipients, such as Congressional Districts 6, 8, and 12, each serving over 200,000 residents reliant on the program, a modest reduction of merely 15% in enrollment could mean tens of thousands losing critical access to essential services. In particular, CD 17 stands out as it supports nearly 281,000 people relying on Medicaid, marking it as the highest concentration in the state. Districts that are particularly reliant on SNAP are also facing heightened risks. CD 24, CD 26, and CD 27 each cater to over 50,000 SNAP households, and experts caution that the transfer of administrative responsibilities to the state could lead to delays, reduced benefits, or new challenges in eligibility, ultimately exacerbating food insecurity. Moreover, residents eligible for both Medicaid and Medicare, the dual eligible, could find themselves in a precarious situation. The loss of Medicaid coverage could disrupt their prescription medications and long-term care options, which might inadvertently lead to increased visits to emergency rooms or long-term care facilities as individuals seek alternative care. In summary, although the law's ramifications will unfold over time, the strain on Florida's health and nutrition services is already becoming apparent. The state's most vulnerable households could be the first to experience these challenges. You can find additional details on this topic in the report linked here. A groundbreaking milestone. In a historic move, Governor Ron DeSantis has enacted the Emily Adkins Family Protection Act, HB 1421/SB 890, positioning Florida as the first state in the country to implement extensive legislation aimed at preventing and monitoring blood clots, such as pulmonary embolisms and deep vein thromboses. This new law establishes enhanced screening procedures across emergency rooms, pregnancy care centers, cancer treatment facilities, and orthopedic clinics. It also mandates specialized training for hospital and nursing home staff while creating a statewide blood clot registry to facilitate better prevention and reporting practices. The legislation is a tribute to Emily Adkins, a 23-year-old who lost her life in 2023 due to a preventable clot. The drive for this law was powered by her parents, Janet and Douglas Adkins, who founded the nonprofit Emily's Promise following their tragic loss. The bill garnered bipartisan support, championed by Senator Clay Yarborough and Representative Dean Black. Doug Adkins, CEO of Emily's Promise, expressed optimism about the law's potential to save lives. "This law will save lives," he stated, emphasizing its role in preventing other families from enduring the suffering they experienced. Advocates such as Leslie Lake from the National Blood Clot Alliance and Dr. Ali Ataya, who led the policy workgroup for this law, were also lauded for their efforts in making this legislation a reality. The law officially took effect on July 3. In case you missed it. A recent report from Magnolia Market Access highlights the financial strain of the 340B drug pricing program on Florida's economy. The program is allegedly causing significant increases in healthcare expenses, leading to millions in lost tax revenues. According to the analysis, in 2021 alone, the program reportedly inflated healthcare costs for employers and employees by approximately $7.8 billion, contributing to a nationwide tax revenue deficit of $1.8 billion. This figure breaks down to $1.4 billion in federal losses and $418 million at the state level. Florida was notably impacted, with an estimated loss of $22 million in tax revenue. Given that Florida does not impose a personal income tax, these shortfalls primarily affect employer payroll taxes and other essential state revenue streams. The program's ongoing viability is likely to become a pivotal discussion point in Washington as lawmakers scrutinize its broader implications. Central Florida's Democratic leaders are vocal about their concerns regarding the potential cuts to health care and education programs tied to the Big, Beautiful Bill. U.S. Representative Maxwell Frost expressed grave concerns during a recent press conference, asserting, "We see this budget for what it is, an extremist roadmap that takes away what people rely on to survive." The 900-page bill, which passed on narrow partisan lines and was signed on July 4, proposes substantial eliminations and cuts to established social support programs, and Frost alongside fellow Representative Darren Soto criticized the legislation for benefiting primarily wealthy individuals. In health service developments, Planned Parenthood's 2 Florida affiliates will merge into a single statewide organization, allowing for comprehensive access across all 67 counties. This new entity, known as Planned Parenthood of Florida, is set to enhance services, increase telehealth options, and extend operational hours at some of its 17 health centers in the state. Following a recent U.S. Supreme Court ruling that permits states to cut Medicaid funding to Planned Parenthood, the Vice President of Communications for Planned Parenthood of Florida, Michelle Quesada, assured that the organization has navigated a challenging political landscape for several years without state financial assistance. Furthermore, a notable sentiment among Republican voters is emerging regarding health care. Polls indicate that a majority of Republicans and MAGA supporters are in favor of Congress extending enhanced premium tax credits for health care access. With the Big Beautiful Bill now law, the focus in Congress is inevitably shifting to urgent matters that require attention before the year wraps up. One pressing issue is the expiration of tax credits associated with the Affordable Care Act, which are due to lapse at the year's end. Should Congress fail to renew them, millions of Americans could see their healthcare premiums substantially increase, forcing many to forfeit their coverage altogether. According to a recent KFF health tracking poll, there is overwhelming support across party lines for the continuation of these enhanced premium tax credits, with 77% of all adults, including 63% of Republicans, expressing their backing for this extension. Regulatory updates. On July 8, the Agency for Healthcare Administration finalized its rule on Qualified Residential Treatment Program services. Further information can be found here. https://flrules.org/gateway/rulano.asp?mark ID =59G-4.128. The Agency for Healthcare Administration also proposed changes to its regulations concerning facial covering requirements for healthcare practitioners and providers aimed at infection prevention. Details can be accessed here. https://flrules.org/gateway/rulano.asp?mark ID =59A-35-125. A new rule regarding examinations from the Board of Psychology will come into effect on July 22. More specifics can be reviewed here. https://flrules.org/gateway/rulano.asp?mark ID =64B19-11.001. Save the dates. Mark your calendar for upcoming birthdays. July 16 celebrates Representative LaVon Bracy Davis. July 21 is the birthday of Senator Gail Harrell. July 22 honors both Representative Alex Andrade and Representative Jennifer Kennedy. Lastly, July 25 marks the birthday of Representative J.J. Grow. This digest has provided a detailed look at the future of healthcare in Florida. What do you think about these recent changes? Do you feel that the shifts in legislation will help or hinder the community's needs? Join the conversation and share your thoughts. 4. Impact of Trump's healthcare legislation on Collier County. Collier County is currently navigating a landscape of uncertainty following the recent enactment of President Trump's healthcare legislation, often referred to as the Big Beautiful Bill. Just over a week has elapsed since this significant law was signed, and a pressing question lingers: what transformations can we expect in the medical care landscape of Southwest Florida? To shed light on this matter, Wink News reporter Maddie Heron reached out to local healthcare professionals for their insights. The reactions to the new legislation are diverse, particularly regarding its potential effects on consumers. One local resident, veteran Gary Helms, expressed his thoughts on the current state of affairs. "I've never seen the country so divided over stuff," Helms remarked, highlighting the contentious atmosphere surrounding healthcare discussions. Having been on Medicare for 7 years, Helms noted that he has not yet observed any alterations in his healthcare expenses. "It hasn't been long enough," he explained. "We've visited the doctors, and our copays remain unchanged, which is pretty much the extent of it." Dr. Jose Baez, who serves as the president of the Collier County Medical Society, anticipates that the new legislation will bring about significant changes to essential programs such as Medicare and Medicaid. If the ACA subsidies are set to expire, those implemented by the previous administration, many patients could find themselves without insurance. This would likely lead to increased premiums, particularly here in Southwest Florida, Dr. Baez warned. In the state of Florida, more than 4 million individuals are enrolled in Medicaid, while over 5 million are part of Medicare and Medicare Advantage programs. Among those affected is Shirley, the mother of North Naples resident John Fitzsimmons. Both are keenly interested in understanding how the new legislation will impact their family's healthcare situation. "You're left waiting for the specifics, but when you hear about issues like waste, fraud, and abuse, it resonates. We all need to be mindful of our finances," Fitzsimmons stated. "I'm relieved to see that these concerns are being addressed." In response to public apprehensions, the White House released a fact-checking page regarding the legislation, asserting that Medicare has not been altered. However, Dr. Baez holds a different view, believing that both Medicare and Medicaid will indeed face repercussions. While efforts to reduce the tax burden on Medicare patients' Social Security contributions are one aspect, failing to provide adequate funding for Medicare savings programs could effectively be seen as a cut to Medicare, Dr. Baez explained. "A major concern is that if patients cannot afford insurance or coverage, they will inevitably inundate our healthcare providers with demands for care. The ramifications of this new act will take time to unfold in Southwest Florida, and Wink News is committed to closely monitoring the developments as they arise." 5. Impact of Trump's budget bill on health coverage in SWFL. The implications of the budget bill in Southwest Florida are significant, particularly concerning health coverage for families. President Trump's budget proposal introduces cuts to Medicaid and reduces the enhanced subsidies provided under the Affordable Care Act, ACA. Given Florida's high enrollment in ACA plans, the expiration of these subsidies could lead to a substantial loss of coverage for many residents. Additionally, new Medicaid redetermination requirements and potential eligibility restrictions may further exacerbate the situation. In Florida, healthcare facilities are currently analyzing the potential effects of these budget cuts. The state has historically maintained strict Medicaid eligibility criteria, which may lessen the impact of these cuts compared to states with more lenient policies and higher enrollment rates. However, Florida stands out as the state with the highest number of individuals enrolled in private ACA plans, also known as Obamacare. The enhanced subsidies that were introduced during the COVID-19 pandemic, which helped many individuals manage their monthly premiums, are set to expire at the end of this year. This expiration could leave many unable to afford their ACA coverage, especially in a state where employer-sponsored health insurance is not prevalent. Health professionals have noted that some individuals may delay retirement plans as they navigate the loss of coverage, particularly those in their late 50s and early 60s who will try to maintain their health and financial stability until they qualify for Medicare at age 65. According to the Kaiser Family Foundation, approximately 4.7 million Floridians depend on ACA plans through the private marketplace, while another 4.3 million are covered by Medicaid, with half of those being children. Trump's budget plan proposes a staggering $1 trillion reduction in federal spending over the next decade, affecting Medicaid, food assistance programs, Medicare, and other essential services. It is estimated that around 350,000 Floridians could lose their Medicaid coverage due to new federal requirements mandating biannual recertification for eligibility. Jonathan Chapman, the president and CEO of the Florida Association of Community Health Centers, has indicated that the number of residents unable to maintain their ACA plans due to rising premiums could range from 25% to 75%. The Congressional Budget Office has projected that without the enhanced subsidies, approximately 4.2 million individuals may find themselves uninsured. In a recent directive from the U.S. Department of Health and Human Services, it was announced that undocumented patients would no longer receive medical care through federally supported community health centers, adding another layer of uncertainty to the healthcare landscape. Chapman expressed concern over the lack of guidance regarding this change, noting that community centers do not typically verify immigration status, making it difficult to assess the full impact. Locally, the Healthcare Network, a non-profit organization serving 71,000 patients in Collier County over the past 3 years, is currently evaluating how the budget bill will affect its patients and their insurance status. Jamie Ulmer, the president and CEO of the Healthcare Network, assured that patients who lose their insurance will still have access to medical care, stating, "We will continue to care for them. Loss of reimbursement is a major pressure, but we have been here for 50 years. We will figure it out." The patient demographic at the Healthcare Network consists of 47% Medicaid recipients, 28% individuals with private insurance, including ACA plans, 18% uninsured patients, and 4% on Medicare. In 2023, the organization provided $16 million in uncompensated care. As a federally qualified health center, it serves a medically vulnerable population and receives higher reimbursements from Medicaid, along with eligibility for government grants. There are 54 such organizations across the state, operating 700 locations to serve similar purposes. Florida's stringent Medicaid eligibility policies mean that the cuts from the budget bill may not be as severe as in other states. However, Ulmer estimates that 10% to 20% of Medicaid patients may lose their coverage due to redetermination processes, income changes, or documentation issues. The new budget bill mandates that states conduct eligibility redeterminations twice a year starting in 2027, whereas Florida has previously required annual redetermination. Ulmer emphasized that losing Medicaid coverage not only affects individual health but also has broader implications for the community. Loss of Medicaid means losing consistent access to primary care, preventive services, medications, mental health support, and chronic disease management, he explained. This could lead to delays in treatment and increased reliance on costly emergency services, ultimately driving up healthcare costs for everyone. Approximately 10% of the healthcare network's privately insured patients are on ACA plans, many of whom depend on subsidies to afford their premiums. With the expiration of these enhanced subsidies at the end of the year, Ulmer warned that health insurance could become unaffordable for many, particularly for adults aged 50 to 64 and self-employed individuals. Any reduction in coverage, whether from Medicaid or the ACA, will likely result in more uninsured patients seeking care from safety net providers, which could have severe consequences. Despite the challenges posed by the federal budget, there are some positive developments, such as Medicaid rate increases in Florida over the past 2 years. The healthcare network is exploring additional operational efficiencies, which may include hiring freezes and enhancing financial stability through grants and fundraising efforts. Ulmer mentioned an upcoming pickleball tournament in September aimed at raising funds for pediatric services, marking a new initiative for the organization. In terms of hospital responses, facilities in Southwest Florida are closely examining the financial implications of the Trump budget bill on patient reimbursements. At the nonprofit NCH system in Collier County, Medicaid accounts for 12% of the patient mix and approximately 6% of total billed charges. Chief Financial Officer Noble Arrington stated that the effects of the proposed Medicaid cuts on patients remain uncertain, but early indications suggest that the focus may be on tightening eligibility rather than reducing reimbursement rates. This means that the primary savings could come from fewer individuals qualifying for Medicaid rather than cuts to provider payments. NCH is committed to understanding how these changes may affect the community it serves, having provided over $67 million in community benefits and charity care in 2024. Lee Health, which transitioned from a publicly operated hospital system to a private nonprofit last year to better compete with for-profit entities, reports that 13% of its patients are on Medicaid, 7% are uninsured, 26% are privately insured, and 54% are on Medicare. Dr. Larry Antonucci, the president and CEO, noted that while the legislation was not specifically a healthcare bill, its extensive changes will undoubtedly impact patient access to care in Florida and nationwide. Florida currently ranks 47th in Medicaid spending per capita, and further reductions in federal support could challenge hospitals' abilities to maintain essential services for all patients, not just those on Medicaid. A significant concern is that 70% of patients at Golisano Children's Services are on Medicaid, making their access to high-quality, life-saving care critical. As changes to Medicaid eligibility are implemented, an increase in uninsured individuals seeking care is anticipated, along with a rise in charity care costs. Antonucci reaffirmed Lee Health's commitment to serving everyone in the community, regardless of their financial situation, and emphasized the importance of ensuring access to quality care as they navigate these financial and operational challenges.